afternoon, everybody. My name is John Griffiths. I am the Commercial Director for Generated Health, and I'm here today to talk to you a little bit about Florence. So, what is Florence? Let me start by introducing you to her. Florence is a persona-based communication tool, and it uses a unique combination of intelligent health messaging and behavioral change techniques to break bad habits and form healthy new ones. Similar to AccuRx, we use exclusively SMS text message for all the same reasons that Satya just described. There's no apps, there's no Wi-Fi, there's no credit required. It is the most digitally inclusive of digital tools to use. It also allows us to do a number of very special things inside Flow. Flow isn't just a tool that collects readings from patients and presents them to you as clinicians to do something about. Flow is actually two-way. So Flow is going to start delivering the advice to the patients that you would have given the patient based on the reading that they've just submitted. Our Chief Medical Officer can't be here today, unfortunately, he's in surgery, but he's a GP down in Sussex, and the way he describes Florence is super interesting actually. He says, if he only had one patient to look after, this is what he'd do. He'd text him every day, how are you, how are you feeling, how's this, how's that, remember to take your meds, don't forget, stop eating crisps. This is what he would do. But he has 22,000 patients, and he doesn't have the time to do that. Well, that's where Florence steps in. Florence is able to automate and deliver that level of care to all his patients. Because we use very simple text messaging, we're able to easily communicate in multiple different languages and even different dialects, depending on the demographics of the patient cohort that we're working with. It also means that we're able to give Flo her own tone of voice. Most of the time, she's quite upbeat and motivational. You're doing really well, keep going. She can be quite stern when she needs to be as well. She can give you a good kicking. And it's by leveraging that bond that we build with patients and leveraging that personality that Flo has with them that allows us to do the behavioural change, the breakthroughs when it comes to that. We're also very fortunate we have an unprecedented amount of clinical trials behind Florence. This isn't just me saying that this stuff works. This is validated that it works, it changes patient behaviours, it improves clinical outcomes, it reduces the workload for frontline teams. When I think about Florence, I think about it as two sides to our platform. There's this bit, this is the patient-facing bit. Patients only know Florence as a text message. And then there's the clinical platform as well, which is our web-based system that sits behind that, the clinical teams use, and they can see all the interactions. But all of our pathways tend to focus on four types of messaging. The first one here is reminders. Flo's asked this patient for their blood pressure. They've not texted in yet. She's chased them, we've got blood pressure. And Flo has analysed it, said that looks all right, have a great day. The second thing she's capable of doing is a sense check. So in this example, the BP reading has come in. Florence has said, it's a bit high, it's not dangerous, it's a little bit high. Sit down for 5 minutes and do it again. So she's going to give the advice that you would have given that patient if they'd have run into surgery just out of getting off the bus. She's going to give that advice to you. Again, BP comes back, it's absolutely fine. This example is from one of our heart failure pathways. And actually what Flo's detected here is a trend. Flo's detected that this patient's weight has gone down quicker than we would have liked. It's not dangerous, but there is a deterioration in weight. She's capable of understanding that, understanding the context behind this patient to say, that doesn't look quite right. And she's automatically going to start changing the messaging now she gives to this patient. She's automatically going to change and remind them more often, more frequently, in a more direct way that they need to stick to their meal plans and they need to make contact if things are starting to get worse. And finally, there's the signposting. This is the extreme example here. If somebody texts in a reading and it's genuinely dangerous, she's going to give the patient the advice to call clinic, surgery, 111, whatever it is. But it's also used to signpost patients to other areas as well, pharmacy, local triage services, wherever it needs to be. She's going to give the advice that you would give that patient. She's going to be able to do that 24 hours a day, 7 days a week. This is the other side of our platform, at least a representation of it. This is what the clinical system does that you guys can see. So the little purple dot buzzing around on the right-hand side there, that shows you where the patient is on their journey. It's easy to see where the patient is in terms of their pathway. Every single interaction we have with the patient is time and date stamped, so we're able to provide you with all the analytics and insights that you would expect. And also what we've got here is, again, all modern dashboards have this, is a RAG rating, a red, amber, green rating of your patient caseload. So you can see at a glance, those patients who are in green, totally fine, everything's in range, ticking along, following advice from Florence, doing really well. Those in amber are those patients who flow has detected a difference in trend. It's not breached the threshold, but there's some deterioration in some way. And those in red, of course, those who have breached the threshold and flow has verified it. So you can see really easily here that those patients that you do need to spend more time with and work with versus those who are doing absolutely fine and managing all by themselves. But this is what we actually do. This is what it's all about for us. And it's about changing behaviour that leads to better clinical outcomes. And this graph demonstrates that perfectly. It's taken from one of the case studies that we've had published in the BMJ, and it's based on a study of more than 1,000 patients across Staffordshire. Now, the study split the patients into two cohorts. There was a control group who were given support by a nurse who phoned them once a week. When they got round to it, when they had the time to do it, they'd phone them once a week, ask for the BP readings and remind the patients to stick to their care plan, which included things like diet and exercise targets as well. The intervention group was given Florence, which would prompt the patients to take their PP readings twice a day. The patients would send the readings into Florence, and Flo would analyse them, signpost them accordingly. In addition to that, taking the metrics, Flo would also give them reminders and motivational messages to encourage the patients to stick to those care plans. Now, what's slightly unfair in my opinion is that the cohort of patients that Florence started with actually had a higher starting average BP than the control group, but nevertheless, within the first month, the average BP for both groups was about the same, and that continued for the next 2 months until the intervention stopped. And that's where I think things get really interesting. So despite both the interventions having stopped in month 3, no patients are getting phone calls from nurses, no patients are getting text messages from Florence, what you can see is that the control group, their average BP goes back to pretty much where they started, whereas those on Florence actually continued to go down. So that's a sign that they've changed their behaviours. They are taking their medication, they are sticking to their exercise plan, they're sticking to their diet plan, and it's actually made a difference to them. They've actually changed their behaviours, and we see the clinical outcomes. And that's pretty typical of what we see in Florence. It's just one of the several examples that we see. This is one from Ayrshire and Arran in Scotland, who managed to lower their HbA1c levels by 15% for diabetic patients. Our maternity teams in West Midlands and the North East of England, they see on average about 83% of their new mums still breastfeeding about 6 to 8 weeks in, versus the national average of about 48%. One of the other health boards in Scotland saw a 75% reduction in patient admissions for asthma patients who've been supported by Flo, which is pretty staggering. And I think personally, counterintuitively, one of our customers in the southwest was absolutely thrilled when they saw a 97% increase for bronchodilators for their COPD patients, because that showed that the patients were taking their medication as they should be taking it, they were using it properly, and they were absolutely thrilled to see that. So I think despite obviously that being an increased cost in prescriptions, it's far outweighed by the savings that we see across the board here, which is reduction in 111 calls, reduction in ambulance call-outs, A&E attendance, inpatient admissions, etc. And actually one of our most recent health economic analysis showed that about £23,000 was saved per 100 patients across the health economy from those using Florence. But I think perhaps what's most important for me is the patient experience themselves. And it's just got a minute's video here which talks about just 3 of the patients who've experienced Florence and had a real change. So let's see if this works.
My hospital admissions went down from 48 to just under 12, and that was in the first year of using Florence. He has made me feel a lot more in control of my diabetes, and my nurse can also contact me via Flo just to make sure everything's good.
I've got a set program. At 9 o'clock I get a text off Flo to take me measurements. I weigh myself, I take the blood pressure, and then I take the oxygen. Then I text them, and within about a minute, I get a text back from Flo. If there's anything out of the parameters, and the maintenance will contact me, and if I felt whether I should have some
flying now. That's massive, so.
Since Flo come into the equation, you feel as if she is really there, you know?
If you can change my life, you can change anyone's life.
I don't feel like an expert. I'm breastfeeding and I saw a big cost of Flo, and
So that's just 3 of our patient examples that we've got where Flo has made a real difference in their lives, and I'm very, very proud of as our patient testimony. So how do we do it? How do we actually get patients to break bad habits and form some healthy new ones? Well, for behaviour to change, we need 3 things. You need to be physically or psychologically able to change that behaviour. I want to be taller, but that's not something I'm physically able to do. Sadly, well, I am probably psychologically able to eat less chocolate, but you need to have the physical capability, the psychological capability to do it. In the same way, you need to have the opportunity to change that behaviour. I'm not going to be able to do couch to 5K if I've broken both of my legs, for instance. And finally, the key here is to have the motivation to change. And without all 3, it's not possible to change behaviours. And that's where our behavioural wheel comes in. By adding Florence as that supporting layer between the professional, healthcare professional and the patient, we're able to give patients the knowledge and the skills and the confidence to change their own behaviour, whilst giving the clinician the insight and support to enhance that patient experience. And finally, by providing that education and that feedback, and most importantly, that support to patients, we're able to raise their self-belief, and we're able to change their attitude, that change is possible, and change does have as much impact on their outcomes as anything else that they could do. And that's what ultimately changes their habits and leads to those better clinical outcomes. So our pathways are all built around algorithms. If the patient says X, Flo is going to say Y. If the patient doesn't say anything, she's going to chase them until they do. It's very much an algorithm. It's very much a structured approach. And these algorithms are the magic behind Florence, and they're always co-designed. They're always co-designed with our team of behavioural change experts, your team of clinical experts. You know your patients, you know your signposting routes better than we do. And most importantly, the best algorithms we have are when we get the patient voice involved in this as well. When we understand from the patient's perspective what's important to them as a patient or as a carer, what do they need to feel and experience and see and hear in these messages, that's what makes them work particularly well. We constantly refine, we use data very, very heavily inside our pathways to know which questions are having the best response rate, which questions take the longest for patients to answer, which questions the patients not always respond the way we were expecting. Very, very data driven. So the more patients who come on this, it's like a flywheel, the smarter and more intelligent these algorithms get, because we're constantly working with our customers to refine them, make them stronger, make them fit their caseloads and their local services much, much better.
Something that comes up quite regularly at this conference is about patient-collected data and whether that flows into the clinical system. Can it with Florence? And is there the choice of which of those measurements you're recording on the system? Is it marked that it's a patient-recorded measurement?
Yeah, that's exactly how it works, actually, funnily enough. So we collect all these readings from patients. I'll use Luton as it's here. Luton collects a number of BP readings over 14 days, 14 days, I believe. And we collect them inside Florence, and then Florence automatically calculates the average, the highest, the lowest, the average, across those number of readings, and it's that average reading that's then snowman coded up and sent back into system 1 as a patient-recorded average BP reading. So it's very similar if the patient was doing some ambulatory BP at home, something like that. The difference is that Flo is prompting them to do it twice a day, getting the response twice a day, and helping the patient then if they do need further signposting. So yeah, all our data can go into the EPR. It doesn't, because nobody wants that. But yes, it is possible to take metrics and snowman code them all and get them to use the system.
Fabulous, thank you. Everyone will help me thank John Griffiths for his talk. And lunch is in the room next door. You can come back at 1:30.